Well, we have Dr. Kshitiz Ranka and he's practicing in Udaipur. We'll be talking about OAB, alright? So sir, according to you, can you please describe for the audience viewing this, that what is an overactive bladder and how does it impact the quality of a patient's life?
See, overactive bladder is not only a disease, it's a syndrome. It has multiple symptoms. Patient will present with urgency, frequency, and urge incontinence. Patient will have repeatedly he or she may have to go for urination, and patient will be bothered with these symptoms. And sometimes what happens, patient will say that since I am going for the urine or micturition, during that time I have leaked the urine. So that will be urge incontinence. And few patients will also say that they will have nocturia. It means that patient will have they have to go for urine again and again in the night, maybe 5 times or 6 times during the night time. So that will also decrease the sleep, and it will cause so many problems, and it will lead to the quality of life will be decreased, and patient will be deprived of the sleep. Right. So these 3 or 4 things constitute, and it makes OAB. With that, we diagnose that patient will be having. We can come to a conclusion, or we can say that we have to investigate the patient. But before that, we can, with the symptoms, we can say that patient is suffering from OAB.
Alright, why do you think that the patients with the overactive bladder delay their visit to a healthcare specialist to get their condition checked out? Is it because they feel it's not a significant problem which needs to be diagnosed? It could be the reason?
It could be the reason, but I will say that the patient should be aware with his disease. He or she should go and visit his urologist for the same. If they will not consult the urosurgeon or urologist, then the things will the things will degrade, or the disease will increase in that manner. And they should consult, they should get investigated, other things should be ruled out also. First, to come for the OAB, there should not be any other problem, so they should consult urosurgeon. The problem with OAB is the awareness. Patients are not that much aware. In rural population, patients are not aware about the things, and they will just continue with the same disease, and the quality of life, as we know, will be decreased with that.
Well, what are the consequences of a delayed diagnosis when we talk about a patient?
If we'll say the delayed diagnosis, it will not cause any gross problem, but it will lead, the suffering will be more.
Yes.
Patient will have incontinence, there will be leakage of the urine, so these things will be there. So the quality of life will be decreased. Patient will not go into the social gatherings. Patient will say, if they will go into the social gatherings, there will be problem, like they will it will cause urine leak, and it will cause a lot of problems.
Well, when we are talking about behavioral therapy, I would like to ask you, what role does behavioral therapy plays in the treatment of OAB, and can you share any success that you had by incorporating behavioral therapy in a treatment regime?
Yes, behavioral therapy is very important. We can say that it is the first line therapy for if a patient comes with OAB. We will ask them to have reduced fluid intake during the night time. They should avoid caffeine, coffee, cold drinks, or you can say that tea. All these things causes overactivity of the bladder. So patient should avoid these things. Patient also should do Kegels exercise. It will increase the the pelvic muscle tone. It will help in holding the urine for a longer time. So these things should be explained first. We will quantify the disease. We'll say that it is a mild OAB, moderate OAB, or severe OAB. If patient is having mild symptoms, we can ask him or her to have this behavioral therapy, so that then we can reassess after 2 weeks or 3 weeks. If she is improving, then we can go ahead with the same. If they are not improving, then we can add some medical therapy.
Is it related to a age? Because there are people who say with the old age it comes like this and then goes.
Yes.
So is it related to age and it is something which is very general and it could happen to anybody?
See, it is what I have seen. I have seen in a little bit, maybe females with 50 years or so. It is more common in that age group, but it can happen in any age group. I have seen patients females who are maybe 20, 25 also, they are having OAB, but mostly it occurs in an older age group. There are patients, old men more than 60 years, who are having BPH with OAB. The symptoms will be overlapping. So there are, but it is much more common in older age group.
Okay, okay. Thank you so much, sir, for your
Okay.
precious time.
Sure.
We are very glad to have you with us.
Thank you.